Good morning, ladies and gentlemen. It is 10 o'clock and time to get started with today's session here on this at least gloomy Wednesday morning in Southeast Michigan, where Action Benefits does its business from. My name is Randy Lober, Growth Marketing Manager here at Action Benefits. And as an FMO and as a Growth Marketing Manager here at the FMO, our job and our purpose is to really help you, independent health insurance agents, grow your business in any way we can. When you succeed, we succeed, and everyone has a happier time with it. So today, what we want to do is introduce a bit of how to solve one of the biggest problems newer agents have, or even honestly veteran agents have, is where do we find our next prospect pool at? And how can we do that at fairly low or no cost? And that's where we want to spend some time here today. I will lead the majority of today's conversation, but I'm also joined today by Debbie Brown, one of the account coordinators on our individual team, and she'll help out by monitoring the chat and with some dazzling color commentary throughout the session, I'm sure as well. Debbie, why don't you go ahead and say hi to everyone before we get started?
Good morning, everybody. Thank you for joining both Randy and I, and we're here to hopefully educate you a little bit and help you with some prospecting things and ideas coming in the future, and we look forward to working with you throughout this morning. Thank you.
Thank you for joining us, Debbie. Lots of expertise there to be shared, and I'm excited for you to share and excited for agents to benefit from it here today. So some big questions we want to answer today, especially in knowing everything that's about to happen to the both under 65 and the Medicare markets. There's a lot of folks that might soon be shopping for insurance because they're going to feel disruption due to benefit cuts or due to the end of the expanded subsidies on the ACA side. So as an insurance agent, it's our job to find them, right? And to serve them and help them find the right fitting products for them. So we're going to try and answer three big questions today using some no-cost tools. First one is we want to help you identify some zip codes near you that have a high concentration of people over age 65. And we'll add another layer on top of that and look for zip codes with a significant uninsured rate, because those are probably folks that are likely in the market for some help with their Medicare products. We'll go a step deeper with that and show you how to figure out which of those zip codes also have a medium income that could make them eligible for D-SNP products. We know that market isn't for everyone, but here in the middle of July, it's a product you can sell year-round so long as someone meets eligibility criteria. So it's a great way for you to build your name in the community, get referrals, get your referral engine going, and also put yourself up for some, mid-year commissions here as well. And on the under 65 side of the house, we know it's looking more and more likely, though nothing official yet, it's looking more and more likely that the expanded subsidies for the ACA marketplace will likely not be extended, which means the return of the subsidy cliff, which means only households making between 138, depending on if you're state expanded Medicaid or not, 138% of FPL, or up to 400% of FPL will receive subsidies or will be eligible for subsidies, meaning your market kind of shrinks. So you got to find out who you can help, right? That would be subsidy eligible in those places. We're going to show you how to use data to answer all three of these questions here today. Before we do that, though, a little bit of background. Where's this data come from? And it comes from the U.S. Census Bureau. And yes, I mean that U.S. Census Bureau, which conducts that census every 10 years. And that's probably how you know them. They come knock on your door, send you a survey, you fill out some information, and then they put it all into a big database. And who knows what happens with it from there? Well, I do. And hopefully you will too here in just a moment. The Census Bureau also does 180 other surveys throughout the year, throughout decades, every other year, to really help keep the pulse on our the demographics in our nation. What's going on, where, who needs what support, what kind of people live where. And those are those programs that we want to focus on here today, outside of just that 10-year census. There's going to be three data sources we pull from today. The American Community Survey, which is updated each December. So that is really a lot of demographic information about who lives in which area. Think of it kind of like a mini census. It's a shortened version of the census you get every 10 years. Updated each June, and why this is important session and why we're doing it here in early July is the county business patterns report. They also take a look at non-employer statistics as well. So they take a look at where are industries gaining jobs, where are industries losing jobs. And if you're not an employer, so an employee, where are you going if you are gaining or losing a job? Are you working in the place where you live? Are you going to the county next door? They do some mapping around that here as well. It can be really helpful for identifying folks that may be eligible for an SEP coming up. And there's also the economic census, which happens every 5 years. The last one was completed in 2022. Data was uploaded to the US Census tool that we're about to use here in March of 2024. So it's fairly fresh data. As you can see, there's about a 2-year lag there between when the data is taken, when it's uploaded, but it still gives us a reasonably good snapshot of what was happening in the community or what's happening in the areas around us at that time. And the tool we're going to use today is a tool really the Census Bureau is designed for this purpose, called the Census Business Builder, or CBB. You can find more information about the tool at the URL highlighted on the screen, census.gov/data/datatools/cbb.html, or if you want to make it real easy, I will give that to you in the chat here in just a moment, cbb.census.gov. And if that's what we want to do today, I want to take you into how we can start answering those questions. And again, 3 big things we want to focus on is figuring out where people over 65 live and are likely to be uninsured. We want to figure out of those zip codes, which of them also have a median income that might indicate some decent eligibility if I'm looking to build my business year round. And again, with subsidies likely to, expanded subsidies rather, likely to expire, where are consumers that will need my help or your help as they are going to shop for coverage or be back in the market for coverage, trying to look around. So to do that, I am going to go ahead and switch screens, show you the Census Bureau. We're going to have a live demo here in just a moment. So I'm going to switch my screens for you. And while I'm doing that, Debbie is going to tell you the best joke she's ever heard.
Well, I'm not known to be a joke teller, so that I leave those jokes to my husband. He has some pretty funny ones, but yeah, so we'll just keep the humor going and with you carrying on over here. So
Okay, fair enough. That was, as you can tell, that was not rehearsed. Debbie did not have something prepared, but that's okay. I won't hold it against her. I will, however, show you the Census Business Builder here, and I'll even do you one better. I'll make it full screen so you don't have to see all my stuff. You'll also see me go off camera, but don't worry, this is a live demo. I'm still here. Just makes it a little bit easier for you to focus where you need to focus here on the screen. So if you were to go to the address that I typed in a bit earlier in the chat, cbb.census.gov, you'd be brought to a screen that looks exactly like this one because I am live in the tool here. And the first thing it asks you to do is to figure out where do you want to look to do business. We're headquartered in Southfield, Michigan, which is in Southeast Michigan. So for ease of navigation for myself, selfishly, I'm going to start there, but you can start with your own zip. Or anything else you might like. So as I punch that in, it's going to give me that zip code, and it's going to narrow us right here on that zip code here, right on the map. But there is no data here yet. There's no colors here. There's nothing going on, which means only that we haven't told the tool what it is we want to see. Want to give you a quick tour of the screen before we dive into working on those questions, because there's lots more uses for this tool than we're going to show you here today. First one is if you are looking, if you are working in the employer group market, though it's not the focus of today's session, you can look at particular industries you want to look for based on their NAIC code. So if you want to look for restaurants near you, and maybe you were the restaurant king of your county, you could look them up and start getting ideas of where those businesses are in your areas, or where you're more likely to run into those. Really powerful tool. Going across the top here, we can also set a variety of variables. We'll come back to this here in a moment, but it lets you filter based on state, metropolitan areas, counties, cities, towns, zip codes, census tracts, which is down to the neighborhood level, and gives you a wide variety of data you can look at here, which we'll come back to in just a moment. You're also welcome to filter that data, which we're going to use to play with here in just a moment as well, to really zero in on some of the zip codes that might be of interest of us, especially when we take a look at some incomes. There's some navigational items here as well that you might deal with. You can change the map you want to look at some settings for the map, zoom in and out. In the bottom left, you're going to get some key information about the area that you're viewing on the screen. We haven't put any data in here yet for it to take a look at. And there's no data over here in the legend just yet. The other thing we should point out, though, is that whatever you are doing in the report, you always have the opportunity to download exactly what it is that you're looking at. So if you come up to the opportunity later where you really like the data set you're looking at, you like the neighborhoods you're looking at, you can download that report, goes immediately into an Excel spreadsheet, and is really powerful for either your own use or giving it to a marketing firm that you might be working with to target those areas. And we'll talk about that a little bit later on here as well. At any rate, first thing is first, we want to find out where folks who are 65 are, and figure out where our targets for Medicare products might be. So we're going to start at the zip code level, but I don't want data about businesses. Instead, I want data about consumers and residents. Gives me an option of some different data types I can look at. We're going to be working mostly with demographic and socioeconomic characteristics, but you do have the opportunity to filter by employment characteristics as well as housing characteristics as well, if there is more granularity you want in what you're looking for. So as you can see here, there's a number of variables we can look at. I want to look first at the percent of population that is 65 and over, 65, of course, being that age where most folks become Medicare eligible. And now I have some data pop up for me down here in my report view down here, as well as the legend over here. As I look at the legend, the things that are areas that are darker blue near me have a higher concentration of folks that are over 65. Areas that are lighter green have a lower concentration of folks that are over 65. So immediately I know that right here in the Southfield area, we're in that kind of that second quintile, at least in our immediate zip code. So could be some good opportunity, but I also see some great opportunity around us here. That's at the zip code level. That can be helpful. I can also pull that out to the cities and towns. So if, for example, I'm working with a marketing house or mailing campaign, I know, for example, that I can look at cities around me. And again, the data is less granular here because I'm at the city level, but I can look at Lathrop Village, I can look at Southfield. I can see that Bingham Farms actually has 52% of the population that is over 65, which could be a great place to do some Medicare marketing or education if I was interested there. Just for completeness sake, we'll also zero down to the census tract level. Census tracts are the sort of the neighborhood level, which is really great for giving you some really targeted marketing activities. So Southfield here, we were looking at Southeast Southfield, our zip code 48075. We are in census tract 1615, 1614. And I know from looking at this that some of these freeway areas here, right, are more densely populated with folks that are over 65 than some of these other areas around that. So that gives me, again, a really good idea of where I can spend some time either doing direct mail, hosting educational events, or whatever it is, if I'm looking to boost my Medicare business. But I also want to get a good idea of whether or not folks here have insurance at all, right? I want to know whether or not I can help them at all, or if I'm spending my time in a place that is going to be fruitful for me. So here at the census tract level, again, we're looking at consumers and residents. But instead of looking at demographics, I want to filter on some socioeconomic, and I want to focus on the percent of people that have health coverage. And knowing that the national uninsured rate is about or the national insured rate rather, if to speak correctly, is about 98% or so, I want to kind of filter some areas out, and I want to go for some areas where I'm going to be able to be a little more fruitful. So I'm going to zero in at right about 95%. So I want to look for folks that really need my help. They are over 65 and they're likely to be uninsured. So if I do that, I have some really narrow ideas of where I can zero in on. If I can look here along the Lodge Freeway, I've got a few neighborhoods in Southeast Southfield. I've got a few neighborhoods down this way. If I can bring it up here to the zip code level, which might be a little more visible to some folks, I know that I've got some areas here just south of Oak Park that I can take a look at here as well. And again, I can look at that a variety of ways too. I can look at cities that might be good candidates for my services here. So lots of different things, ways we can slice and dice that data. By looking at the uninsured rate and zooming out, we can really see, where you're likely to run into some folks that are more likely to need your services and need your help, and really decide to target your marketing efforts in those areas. Debbie, I want to pause here for anything you might want to add or any patterns you're seeing here, or anything that surprises you before we answer our next key question about DSNP eligibility.
Sorry about that. That was my mute was off. Can you repeat what you just said?
Yeah, I'm just looking for anything that sticks out to you, anything that surprises you, or anything you might want to add about where agents could look in these areas as they're considering marketing themselves in the Medicare area.
No, I mean, just overall, just using this tool, I think I just checked a few things myself. Like even in my area, I was surprised of what I saw, but the idea that you could see if it's a big populated area for 65 and under, if that's or over, if that's what you're looking for, it's kind of a neat tool to use. I'm going to make sure I start using this more and more just to kind of get an idea to help agents out ourselves. So, yeah, great opportunities for the agents.
Absolutely. There's lots of ways to use the tool here. And again, we're not showing you everything, just some of those common questions you might try to answer as you gear up for your big marketing pushes in third and fourth quarter here. Second big question we want to answer today is all of the folks that are over 65 and over, and you're going to see me get rid of the filter here. I can do that with the trash can. Second big thing we want to figure out today is where are some households that are likely to be DSNP eligible. So as a Medicare broker, I might be looking for opportunities to sell year round. And unfortunately, the Census Bureau doesn't collect data on folks that might be CSNP eligible. I don't have data on chronic conditions necessarily, broken down by heart disease or lung disease. But what I can do is use some income data to figure out which areas could be DSNP eligible to help me help those communities year round, and help me also grow my book of business and new business commissions here as well. So I'm going to leave the same primary variable in place. I want to explore by folks that are looking at demographic characteristics, and I want to look at folks who are 65 and older. What I can do now is I use that same filter capability, and there's a few different filters we're going to want to add here. The first thing is going to be our socioeconomic characteristic, rather. First thing I want to look at is the median household income. What I want to look at here in Michigan is I want to look at households, if I'm generalizing a little bit, folks that are likely to be eligible for DSNPs are probably in either 1 or 2 person households. So I want to filter down to areas that have a median income that is about the 2 person mark for the 130%, 38% of FPL here in Michigan. And that figure happens to be 27,187. So I don't want to see zip codes that are way up there, right? I want to filter down here. Maybe I want to allow for households that could be up to 3 in size, which in that figure goes up to about 38,000 here. So if I give that 38, I can type in that 38,000. And that really narrows down my options here, right, of where I want to go in terms of cities or towns. If I broaden out to zip codes, I'm going to see a little bit more data here once it finishes uploading here. So I know that if I were to work down into more into the Detroit area, more in Southeast Michigan, right here on the Canada border, there are a lot of zip codes here where I could find some clients. I got Highland Park, I've got Hamtramck, I've got right here next to Belle Isle, which has a large population of folks who that are 65 and older and meet those income thresholds that we're talking about. If I maybe was not in the Detroit area, I wanted to zoom out. I see there's opportunity here in Pontiac, closer to northern Oakland County. And even if I wanted to look at other areas here and kind of zoom around the state, I could do that and look for splashes of color to really figure out what could be helpful for me here, like over here in the Grand Rapids area. So again, it's a smaller market, not as much opportunity for you there, but when you're taking advantage of the data sets available to you, again, you can really hone in on where you might find some good prospects for you. Here, the Flint area included as well. Debbie, anything to add around looking for DSNP prospects before we move over to that under 65 conversation?
No, I think you got everything covered at this time.
Okay. And you see, as I zoom in and out here, it tells me when I can and can't see different areas here. That's why you sometimes see it go gray. I'm going to recenter us back here on Southfield, just so we have the same orientation. And looking at that zip code, the last question we want to answer today is folks that may be marketplace eligible, right? We know that it is increasingly likely that those enhanced subsidies will not be extended. So we want to figure out where, again, are folks that will need my help. So I need to change my data set a little bit. Generally speaking, while we know there's people under 18, or you can have your child under policies, you know there are folks that are over 65 who for some reason might be on the marketplace because they're not yet Medicare eligible. What I want to focus on here is I could look at 21 and over. Maybe, there's folks shopping around. But generally speaking, we've got a lot of college kids. We've got lots of college towns in the state. So 21 and over doesn't quite do it for me. I really want to look at folks who are working age. So I'm going to change it to look at the percent of folks that are working age. And that gives me, again, right away where I might see some ideas that are marketplace eligible, right? And gives me some ideas of it coming back up to the city level. I've got some opportunity here in Wixom, where I hail from. I've got some opportunity in Royal Oak. I've got opportunity in Berkeley, here in Southfield. Lots of different areas I can look here. Lots of potential folks who are maybe marketplace eligible. But I also know that subsidy cliff is likely to return, right? In households making above 400% of FPL for their household size will likely not be eligible for any advanced premium tax credit on the marketplace, which is going to probably change, again, the composition of who's going to be in market for marketplace coverage. So I want to be able to kind of index around for that. And there's a few things I want to do to be able to do that. First thing I want to take a look at is socioeconomic characteristics. And I want to look at their median household income. And again, I want to look at between 138% of FPL because Michigan expanded Medicaid. So 138% for a family of 3 is $36,777. Up all the way up to 400% for a family of 3, which is $106,600. So if I'm looking again only for the family of three here and only percent working age, I've got some better ideas here of where I can find folks that might need my help searching for marketplace. I've got lots of opportunity again in Wixom. I've got Walled Lake. I've got Wolverine Lake over in Southfield area itself. Southfield has some opportunity, but again, more opportunities in Oak Park, more opportunities in Redford, Hazel Park, Ferndale, Royal Oak, some other areas here as well. If I were to come up to the county level, just to get a different scale of analysis, if you want to market some other ways, again, I've got lots of opportunity maybe in mid-Michigan here as well, looking at the Lansing area, looking over in West Michigan, looking at Midland, looking at Gratiot, lots of different ways I can cut and slice that data here as well. But again, those income filters and household size really give me some opportunities here. And if I wanted to add one more filter, because you can add multiple filters to the map and look at their housing characteristics, and I wanted to take a look at their average household size, which has moved on me here. I could also filter in down in by the average household size here in just a moment, which appears to have moved in the latest update. So I won't waste your time looking for it, but it is an opportunity for you to go ahead and find that additional data. At any rate, we've taken some time to answer some of those three key questions about where you can find prospects to help further your business, and that's all good news. But the next question you probably have is, so what do I do with that data? I'm going to change screens. I'll let Debbie maybe think of a good joke that she's heard from her husband while I change that over.
Randy, you're really putting me on the spot with the jokes. Now I have to make sure I bring my joke book next time.
Fair enough. The question is now what? I have this data in front of me. Randy showed me this map with all these colors on it. Debbie didn't have any jokes to tell me about the map. What do I do now? And the answer is, well, you use that data to figure out where you want to spend your time and how you want to market in those areas. First things first, though, is I have to say this, no matter what you choose to do in terms of marketing strategies, remain compliant with the guidelines in your target markets. For example, it is totally okay, though not efficient, for you to go door to door to solicit under 65 business. If you have that neighborhood that has a high percentage of folks that are working age and falls within income brackets that would make them likely to be marketplace eligible for subsidies, yeah, sure, go knock on doors if you'd like. But you can't do the same for Medicare business, right? There's strict, strict prohibitions on unsolicited contact with beneficiaries. So depending on what you're doing there and why you're doing that, just always be mindful of those compliance guidelines, and where those pop up here today, I will call those out as well. But there's a lot of things you can do with the data here. And by what we have here isn't everything you could possibly do, but it's 6 things you could do. And if we want to think about these on a continuum going from left to right, on the left-hand side, those activities are generally more expensive, but have a broader reach. On the right-hand side, you have things that are less expensive with a narrower reach. So we'll talk about partnering with a mailing house or looking at every door direct mail from USPS and targeted social media ads as kind of those more expensive campaigns. Some of the less expensive things are community events and sponsorships. So we're getting your boots on the ground, doing that door-to-door or community-based marketing, or thinking about how you might work it into your referral asks here as well. So your first option to partner with a mailing house is to take a look at those cities, zips, or census tracts that are most valuable to you. They're most likely to be prospect rich, and craft targeted mailings for that market. Of course, again, any materials you send must be compliant with the rules in those target markets. But sir, there's some examples about what you can do here. Nearly every carrier on the market has turning 65 postcards, or postcards that get you prospects ready for AEP, or let them know that AEP or OEP is coming up. You could use some of that carrier provided material, bring it to a local mailing house or mailing vendor near you. and say, hey, I've identified this area as an area that probably has some prospects for me. How can you help me get this out? Some pros to this approach is you can give you some really tightly targeted messages to the areas you're interested in. But generally speaking, direct mail may not be as cost effective as other options. Although we are seeing that pendulum start to flip, pendulums start to swing, rather, pendulums don't flip. Depending on the kind of direct mail you send, some folks actually are appreciate getting mail. Your email inboxes are so full, you get 300, junk messages a day on average, that you're not going through them all. So sometimes a really well-crafted direct mail piece can be a good solution for driving in some inbound contact. Second thing you could do, maybe you don't want to work with a publishing house, so a more affordable option is working with every door direct mail, but funded by the USPS or presented by the United States Postal Service. And again, you can get some good ideas about the areas you want to locate, but when you log into that tool, the Everyday Direct Mail by USPS, you can do that same data analysis that we just did down to the individual mailing routes in your neighborhood or in the area that you're looking at. So you can say, yeah, I want to give a flyer to every person on this mail route that is likely to be over 65. And while, again, everybody on the mailing route gets whatever it is you want to send, so it's very much a shotgun approach. With the right kind of targeting, the right kind of data, you can really get a pretty good idea of what you want to, where you want to spend for about 55 cents a piece. And that's a fairly good rate, all things considered. Again, I'd remind you to be compliant with the rules in your target markets. And really the pros here again are it's more cost effective for you, especially if you're just dipping your toes into marketing. You're going to see some cost savings here because a lot of the labor is on you, frankly, in terms of getting the piece and getting it to the post office for them to deliver. But the con might be, again, it's still kind of a shotgun approach, although you can get pretty targeted down to the mailing, down to that mail route. There's still no guarantee that everyone in that mail route is in market for what it is that you have to sell them. The other thing you can do of the paid options we're talking about here today is targeted social media ads. And you can do these really well for as little as $5 a day. If you were to look at the areas that have prospects that were most valuable to you, right? And put a ad in place running there on Facebook, on Instagram, on whatever it is you happen to want to advertise on, and we can help you with that here as well. There's pretty good reach you can get there. Generally speaking, for about $5 a day, you can guarantee you get your name and face in front of around 700 folks per day. And that's a fairly good ROI, right? Again, not everyone there in those 700 may be in market for what you have to offer, but no publicity is bad publicity, especially when you're paying for ads here. So that can be a great option for you as well. Debbie, anything to add around some of those paid marketing approaches before we go on to some of the unpaid things here, or anything you've heard from agents about that they're succeeding with when they're talking about their paid marketing?
No, not at this time, but I do have a good joke. What do you get from a pampered cow? You get a spoiled milk. That's all I got to say for the day.
Okay, we can definitely appreciate that and the spoiled milk. It does remind me, actually, this is of a really neat strategy I saw an agent do. I worked with an agent in Farmington Hills who wanted to run paid social media ads. And what he ended up doing was two things. He ran ads, you know how on the end of a shopping cart, you can there's ads like at the end of your shopping cart or on the front or whatever it is. So he put his name and face there. There's one place he got seen, but he also ran paid social media ads in the radiuses around the grocery centers in his house, right? So anyone within a 5-mile radius of that Kroger that he also had the shopping cart ads in would see his name and face when they're scrolling the phone. So when mom is in line at Starbucks getting her coffee at the Kroger, she's also seeing that agent's name and face. So she's seen it in the shopping cart for like the whole hour shopping trip. She's seen it on the cell phone as she's scrolling, waiting for her Starbucks order to be made, or while she's waiting in checkout. And she's gotten some good exposure to that agent. It's done really well for him so far. Another way you can use that data and those kind of tools. If you're looking for things that are less expensive, but more perhaps labor intensive, getting boots on the ground is always an option. And there's some ways you can do that in the Medicare market, some ways you can do that in the under 65 market. On the Medicare side, again, I have to say you must be compliant with CMS guidelines, but there's still a lot of ways to be creative within those guidelines. Think about informal marketing events at local pharmacies or community centers or senior centers or pickleball courts, fairs. We're coming up in the church fair and festival season. Everybody has a summer festival or fair. Really easy to report that event to the carriers, get yourself a little table at those, and really start talking and being seen in the community. Other thing we should point out is independent pharmacies, gosh, they're hurting, right? Just as pharmacy chains are hurting as well, but your local mom and pop pharmacies are hurting too for a variety of reasons. They need customers to come to them. So if you can work out an arrangement with that local pharmacy where you certainly can't set up a table at the pharmacy counter, but in the back of the store or somewhere out of the way. And kind of your pitch is, yeah, I can help your clients stay with you. I can help your clients find plans that are that your pharmacy is in network with, so you can keep that business. They can be open to that pitch here as well. You might also say, hey, there's a lot of seniors that live in Southfield. There are lots of seniors that live in XYZ area. And that might be the area where you want to do your formal educational events. Do I want to look at Medicare 101s? Do I want to look at formal marketing events where I'm doing plan presentations in those areas? Those are opportunities here as well. And again, you have a good idea of these could be high traffic areas. So maybe I want to spend time giving flyers and business cards in doctor's offices, pharmacies, restaurants, doing those kinds of things. Those are all options for you that you can still compliantly advertise your services in the Medicare market. On the under 65 side, again, it's nearly the Wild West with how you advertise, but you've got a lot of the same tools available to you, right? Door-to-door becomes an option, but you can also do informal marketing events nearly all in the same places, right? To be where you're likely to run into folks. And again, you have the opportunity to, get your name and face out in doctor's offices, pharmacies, so on and so forth. The other underrated option that I would love to see more of our agents take advantage of is community events and sponsorships. There is not a PTA or a PTO or a school in this city, in the country, that is not looking for sponsorships for events, whether that's fun runs, whether that's charity drives, whether that's fundraisers and so on and so forth. And for sometimes as little as $200, sometimes $500, whatever their cost might be, you get your name, you get your agency logo on the back of every K through fifth grader in your neighborhood. Gosh, what a great investment, because everywhere they go, they're a little walking billboard for your agency, and that's a great place to be. But again, you can also, if it's in your budget, you can sponsor those art fairs, sponsor those festivals, or at least show up at them and be around. Just when you do so, be mindful of CMS guidelines, especially if you're working in the Medicare market. Again, you can't approach people. You got to let people approach you if they want to deal with Medicare plans. And the last thing you can always do, and really has nothing to do with outbound marketing, but I always want to give this reminder to our agents, is you get what you ask for. And so many folks, so many of your clients really don't know that, especially if you're, whether you're a just starting out agent or a veteran agent, they don't know that your business depends on referrals, right? Referrals are the lifeblood of your business. So if you know someone who might be seeking Medicare coverage, I can help and put a few business cards in their hand. Or who do you know that's losing Medicaid? Could be a pertinent question coming up. Or who do you know that's losing marketplace coverage coming up? Chances are they know someone that will be impacted by market disruptions coming up in the fall. That gives you an opportunity to put business cards in their hand and gives them an opportunity to spread your name and all of the good work that you have done for them in finding a good fitting product and service them and beyond. So I'll always make that referral ask. Can't say it enough because it's easy to forget, right? Especially after you're patting yourself on the back for getting that enrollment done and across the board. Debbie, anything to add about those strategies here before we wrap up for our day?
No, those are actually just great strategies. If you guys use that as your practice, it'll just help you become more successful. We're always here for you if you want to talk the strategies out. There's several of us on the team here. We can always walk it or talk it through and come up with some other things to help you out.
Yeah, and not to oversell the point, but we do boast an 8-person individual team that is on call. They have conversations like this, and just as Debbie is here today. So if you're in need of marketing support, or need to bounce an idea off someone, because insurance can be a lonely business, right? Your friends probably, while you may have networking events, your friends probably don't know your business the same way you do. If you need that guidance, you need that support, we can do that. In addition to processing your applications and all the other back office support we can provide you as well. So that said, folks, that brings us to the end of our time here together today. I want to thank you for your time and attention. Should you need to get a hold of Action Benefits, or you want to find out more about us, you can visit us on LinkedIn at the Action Benefits Company. You can email me and my team at learning@actionbenefits.com, or Debbie's team at individual@actionbenefits.com, or reach anyone on our main line at 248-356-8585. And Brenda, the best receptionist I've ever met, the most friendly voice you'll ever hear, will help you find the people that can help you. Debbie, before we close out for today, what parting words do you have for our audience?
Yeah, like Randy said, there's 8 strong on the team, and we're here to help you. We want to make you a success, because if you're a success, we're a success, and it all works out. Keep in mind, Action has a lot of great opportunities, learning opportunities, so make sure you keep an eye on the Action calendar. There's a lot of trainings. I'm sure Randy's going to mention this, but we have our summit coming up. Just a lot of great opportunities. If you're not sure of how to find these things, please give us a call. We'd be more than happy to discuss anything with you. And we are 8 friendly people. So give us a call.
Please do. As Debbie mentioned, we do shortly after you leave here today, our training calendar will pop up on your screen. You'll see everything we have scheduled out through early September, which includes several carriers. Not everyone's yet, but several carriers, Medicare product launches. So do encourage you to scroll down, see those carriers you're interested in, and sign up for those. You'll also see on August 14th, our annual AEP OEP kickoff is also scheduled. Register for that. We've already got about 80 of your closest friends and competitors that'll be in the room there with us. Would love to see you there too. All that said, folks, thank you again for your time and attention. Always love spending time with the agent community here. Please let us know if you have any questions. But I promised you 45 minutes, and we are here at 43 minutes, so we think we did pretty well with that here today. Please enjoy the rest of your mornings, and we look forward to seeing you all again soon at another Action Academy session.